Hey, my name's Peter Wilson, and we're talking about schizophrenia today. Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may think they have lost touch with reality. Some general symptoms of schizophrenia. They usually start between 16 and 30. There's three different types: positive, negative, and cognitive. Positive is your most common example, or what is usually diagnosed to go along with schizophrenia. Positive symptoms are psychotic behaviors not generally seen in normal, healthy people. Examples are hallucinations, delusions, and thought disorders. Negative symptoms are disruptions to normal emotions. Examples would be reduced feelings of pleasure, difficulty beginning and continuing activities, and also reduced speaking. The last example, which is also the hardest to diagnose, is cognitive, which is a change in memory or other thinking aspects. Examples of this symptom are trouble focusing or paying attention, and also trouble with memory. The research to go along with schizophrenia is scientists have not been able to identify an exact gene to go along with schizophrenia. So, like with other things like Down syndrome, the specific chromosome that is altered in the individual that has Down syndrome. But with schizophrenia, there's no exact chromosome or gene to go along with it to show why someone will have schizophrenia. And also, there's no linear passage between family members of schizophrenia. In certain cases, 3 or 4 family members will have it, and a fifth one will not. Or where there's not a family history of schizophrenia, someone might get schizophrenia. So there's no actual research to show how accurate the passage is, and also go along with that. That's why they don't have exact research for the gene. Treatments of schizophrenia are antipsychotic drugs, and then you have psychosocial treatments, which is where they try to teach them how to get back to normal life and how to live a normal life. But this usually comes after they've found a good medication to help them. And in certain cases, of more advanced cases, they'll have coordinate special care, which is just someone that will, make sure they're taking their drugs, make sure they're going to treatment, and then also to just take care of them. Schizophrenia.